There's a common narrative that derms and esties are somehow at odds when both are really groups that just care about making your skin better. They just fundamentally approach things very differently. So we have different training, different risk tolerance, different scopes of practice. With dermatology, we're thinking about things from a medical responsibility perspective. We're trained to diagnose and treat disease. We anticipate complications. We treat complications. And so things that kind of seem like maybe they're just a really benign aesthetic concern could really be something major. So the level of like diagnostic responsibility creates a little bit more of a conservative approach with dermatologists. Estheticians, on the other hand, are really highly skilled at, skin maintenance, barrier repair. They offer client support. They have the luxury of also spending a lot more time with their clients to kind of instill skincare routines, get that glow, that hydration, the visible results that they really want through like a non-invasive model of care. A lot of the concern arises when you have things that overlap, like chemical peels, microneedling, acne treatments. And, for dermatologists, we're thinking about the risks that these things carry. So, scarring, infection, pigment alterations, especially if we're delaying diagnosis for certain conditions and what the ramifications of that is. And ultimately, we're the ones that end up having to treat that when something goes wrong. So it's not necessarily that we oppose estheticians or have a conflict or an opposition with estheticians, but it's just that sometimes things feel unsafe to us when they're performed outside of the scope or context of what everybody's training is. And so I think in the best case scenario, derms and estheticians should really be working together in order to get the best outcomes on skincare for patients. We both are coming from a place of wanting the best for a patient's skin. And so I think a really good collaborative effort is really where the two align, and the patient is actually the winner of that.